South Korea introduced what was considered one of the largest and best organized epidemic control programs in the world, along with Taiwan, Vietnam, and Singapore. Different measures have been taken to screen the mass population for the virus, and isolate any infected people as well as trace and quarantine those who contacted them, without further lockdown. The rapid and extensive tests taken by South Korea have been judged successful in limiting the spread of the outbreak despite not using the drastic measure of quarantining entire cities. In its efforts to fight and contain the virus, South Korea has combined testing with contact tracing. Infected South Koreans are required to go into isolation in government shelters. Their phones and credit card data are used to trace their prior movements and find their contacts. Those who are determined to have been near the infected individual receive phone alerts with information about their prior movement. Those ordered to self-quarantine are required to download an app that alerts officials if the patient moves outside of the quarantine. Violators are fined up to $2,500. The first confirmed case of the pandemic of coronavirus disease 2019, COVID-19, in South Korea was announced on the 20th of January 2020. According to the Centers for Disease Control and Prevention Korea (CDC), the sudden jump is mostly attributed to patient 31, who participated in a gathering at a Shincheonji Church of Jesus, the Temple of the Tabernacle of the Testimony Church in Daegu. Amidst the fears of further contamination, mass gatherings in the affected cities were cancelled and a few hundred soldiers in Daegu are in isolation. On the 4th of February 2020, in order to help prevent the spread of COVID-19, South Korea began denying entry to foreigners traveling from Hubei province. By the 9th of April 2020, South Korea had about 10,423 cases and 204 deaths, with over 494,711 people having been tested, a case fatality rate of 1.95%, which is lower than the WHO's global case fatality rate of 4.34%. In this video, we are going to discuss the impacts of COVID-19 in South Korea and their response. What impacts of COVID-19 does the country of South Korea face? How did they respond to these impacts? 1. Economic impact. The economy of South Korea is forecast to grow 1.9%, which is down from 2.1%. The government has provided 136.7 billion won for local governments as support. By the 18th of March, South Korea's Kospi stock index had dropped nearly 30% compared to a month earlier. The drop began on the 23rd of February, when the country raised the coronavirus alert to highest level. On the 15th of March, the Kospi closed at 1,771.44 and the Kosdaq finished at 524 points, down 7%, prompting the Financial Supervisory Commission to impose a 6-month ban on short selling, the first such action in nearly 9 years. This was despite a markedly lower daily increase in cases. Automaker Hyundai Motor Company, having shut down its factories as the outbreak intensified, saw exports drop 21.4% in February from the same month last year. Korean aviation and retail companies are being similarly hit due to coronavirus. Singapore Airlines is reported by Reuters as having mentioned that the biggest slump in demand on flights is to South Korea and Japan. One of the workers at a Samsung electronics plant in Gumi, South Korea, tested positive for coronavirus, following which the remaining workers were asked to home quarantine. Samsung, meanwhile, announced a donation of 30 billion Korean won $24.7 million in the form of medical supplies and daily necessities to support the COVID-19 affected areas. The donation was offered to the National Disaster Relief Association. A number of duty-free retailers are closing their stores temporarily during the outbreak period as contact tracing led to the discovery of visits by coronavirus-affected people, reported South Korean news agency Yonhap. The government has imposed a rental fee reduction rate of 50% for those businesses operating out of airports and duty-free retailers to support these businesses amid the COVID-19 pandemic. Further, 420 billion won $343 million is planned to be provided to small-sized retailers and communication equipment operators. 2. Social impact. As of the 25th of February, Daegu officials were aggressively warning residents to take precautions, while allowing private businesses such as restaurants to stay open. As a precautionary measure, many restaurants check the temperatures of their customers before accepting them. It is common for offices, hotels, and other large buildings to use thermal image cameras in order to identify people with fevers. Apart from the city of Daegu and the church community involved, most of South Korea is operating close to normality, although 9 planned festivals have been closed and tax-free retailers are closing. The South Korean Military Manpower Agency made an announcement that conscription from Daegu will temporarily be suspended. The Daegu Office of Education decided to postpone the start of every school in the region by 1 week. Numerous educational institutes have temporarily shut down, including dozens of kindergartens in Daegu and several elementary schools in Seoul. As of the 18th of February, most universities in South Korea had announced plans to postpone the start of the spring semester. This included 155 universities planning to delay the semester start by 2 weeks to the 16th of March, and 22 universities planning to delay the semester start by 1 week to the 9th of March. In some ways, South Korea's back-to-school move for its more than 1 billion students will be a test case for the rest of the world. In some corners of the globe, school closures have sparked a fierce debate about whether pupils should repeat the academic year or continue distance learning. South Korea is integrating its students into online teaching on a complicated schedule, based on age. The oldest children started classes a week ago, and others started on April 16th. The youngest will only resume studies on April 20th, while kindergartens and daycare centers will remain suspended indefinitely. For South Korea's highly educated student population, the move online has triggered mixed emotions. So far, South Korea's Ministry of Education has modified the school year significantly. Winter and summer vacations will be shortened, while instructional days will be made longer but fewer. The ministry also has instituted an official, government-run preparation and monitoring team to help teachers develop online classes and modify their lessons. Entertainment agency SM Entertainment reportedly donated 500 million won in efforts to fight the disease. In the K-pop industry, the rapid spread of the coronavirus within South Korea has led to the cancellations or postponing of concerts and other events for K-pop acts within and outside of South Korea, with example situations including the cancellation of the remaining Asia dates and the Europe leg for 17's Ode to You tour on the 9th of February 2020 and the cancellation of all Seoul dates for BTS Map of the Seoul tour. 3. Travel restrictions. As of the 20th of March, a total of 171 countries and territories had issued entry bans or suspended visas for travelers from South Korea. On the 16th of March, USFK announced that travel restrictions for Cheonan City had been removed due to a decline in COVID-19 cases. Troops and Defense Department personnel residing in Cheonan were told to contact their command prior to returning to work. 4. Reactions from KMA. On the 26th of January, the Korean Medical Association (KMA) asked the government to temporarily bar entry to all travelers arriving from mainland China, but this recommendation was not followed. On the 27th of January, KMA President Choi Dae-sip said, "The third confirmed case indicates that we have reached the point where we have to get rid of passive stance and actively prepare for the worsening of the situation, and the government should thoroughly monitor the trend of China's national outbreak of the virus and prepare administrative measures such as complete entry ban from China in case of the worst situation." On the 3rd of February, the KMA recommended halting all travel from China rather than only from Hubei province. After all, the KMA called for stronger government response in a total of 6 statements between the 20th of January, when the nation's first confirmed case occurred, and the 18th of February. A short time after that, cases spiked in Daegu and throughout the country. 5. Public reactions. Although there are many confirmed cases of COVID-19, President Moon Jae-in's approval rating rose by 2 percentage points to 44%. In opinion poll conducted by Gallup Korea in the second week of March 2020, President Moon's approval rating has risen by 5% to 49%. 6. Anti-foreigner sentiment. In February 2020, an entrance to a South Korean restaurant in downtown Seoul reportedly had a sign in red Chinese characters stating, "No Chinese allowed." No Chinese signs have been cropping up, and some businesses are simply banning all foreigners. Some foreign residents have been excluded from the government mask distribution program, as it is currently only allowed to 1.25 million foreigners who were subscribed to the public health insurance. Concerning COVID-19, more than 760,000 South Korean citizens have signed a petition lobbying the government to ban Chinese tourists from entering the country. The Daegu Lantern Festival mistakenly posted a notice in English that no foreigners are allowed to visit. However, the wrong sentence was removed and it was revealed a translation error by the PR agency regarding statement from a Daegu government official. The official in the Daegu city stated that the original message was the notification to foreign tourists about the delayed schedule of festival over COVID-19 concerns. Jamaicans have reported widespread discrimination, and foreigners were excluded from city-wide stimulus funds, with the exception of Anson City. 6. International response. On the 24th of February, the United States Centers for Disease Control and Prevention (CDC) upgraded the status of South Korea to Level 3, avoid non-essential travels due to widespread community transmission. On the 28th of February, Charles Schwab Corporation advised employees who had traveled to China and South Korea to self-quarantine for 14 days. Multiple companies such as Amazon, Google, TD Bank Group, Bank of Nova Scotia, London Stock Exchange Group, and Cargill, Inc. deferred all non-essential travels to areas affected by the outbreak. As of the 8th of March, U.S. military has suspended all travels to and from South Korea for all military personnel and their family over the concern of the virus. As of the 10th of March, 109 countries or regions restrict entry of visitors from South Korea. 7. Recovered patients tested positive again. On the 13th of April, it was reported that at least 116 individuals who were infected and later cleared of the virus had again tested positive. By the 17th of April, the KCDC stated that it knew of 163 patients who were said to have recovered, but again tested positive. The exact cause was not known, but they stated several possibilities. Top KCDC officials said in recent briefings that the most likely possibility is reactivation of remaining viruses in patients' systems. If a patient had not developed sufficient immunity against the virus, or if a patient's immune system weakens after recovery, the previously undetectable level of virus concentration could rebound. Or the novel coronavirus may be capable of staying dormant before reactivating. Another possibility is that tests are picking up dead virus particles that are no longer infectious or transmissible. KCDC Director General Jung Eun-kyung said that viruses collected from 6 relapse cases could not be cultivated in isolation, signifying that they are either dead or too small in number. But some relapsed patients may have living viruses that make them sick. A live virus is probably also transmissible, according to Jung, but no secondary transmission by relapsed cases has been reported. Reinfection through another virus carrier is a less probable scenario, considering that patients are retesting positive not long after they are released from treatment. Jung said that relapse cases are detected an average of 13.5 days after recovery. The longest reported interval, however, is 35 days. KCDC has also mentioned errors in testing or sample collecting as potential causes. Short of definitive answers, authorities are for now advising recovered patients to stay home for an additional 2 weeks and to monitor for symptoms. There are factors that made the South Korea a winner over COVID-19 pandemic. A. Rapid response. Mass testing resulted in many patients testing positive, leading them to be hospitalized. However, it soon became obvious that the hospitalization of all patients would overload the entire health system with a shortage of beds for severe COVID-19 patients and impact on other severely ill patients. In order to avoid this crisis, patients were prioritized based on severity. Large suburban residential buildings, used by public enterprises or large private firms for education, training and short-term residence of their employees, were transformed to house patients with milder symptoms. These patients are evaluated by a physician who checks their temperature and respiratory symptoms twice a day. Vulnerable patients, such as older patients or those with pre-existing conditions, along with patients with severe symptoms of COVID-19, are given higher priority and hospitalized. B. Universal health coverage for communicable diseases, such as COVID-19, copayment of NHI is exempt, and the financial burden of treatment is minimized for patients. As mentioned earlier, the cost of testing is free for most people. Although more than 90% of hospitals are private, they all participate in the NHI system with the same contract conditions for both public and private providers set by law. When masks are rationed, they are distributed by pharmacies using the NHI database. The COVID-19 experience highlights how UHC is an important foundation to cope with epidemic and health security crises. C. Lesson from MERS. The painful experience of MERS, Middle East Respiratory Syndrome, with 186 cases and 38 deaths in 2015 has led to lessons learned and a quicker response from both the government and the public. The current administration invested more funds in the health sector compared to prior administrations. As the first early cases of COVID-19 were reported, the government was already on a fast track to prepare mass production of test kits, a key step for early detection and swift containment of the virus. The public also were prepared to accept the extensive contact tracing for effective detection at the expense of privacy. As a result, the government and the public worked together in containing the disease as quickly as possible to prevent a repeat of the MERS crisis. D. Gesture of leadership. A gesture of leadership would improve the morale of frontline medical workers and citizens. For example, when there was a severe and large outbreak of COVID-19 in Daegu area, the South Korean Prime Minister positioned himself in Daegu and directed the response to the outbreak there. The presence of top leadership in the epicenter of the pandemic could facilitate strong support and response to alleviate further infection as it did in Korea and improve communication between all levels of governments. Thank you for watching. If you are new to this channel, please press the subscribe button and notification bell for more informative and entertaining videos like this. If you are already our subscriber, please comment topics for our next video and you will get a free shout out. What are the impacts of COVID-19 for the other countries? How did they respond? Here are our video suggestions for you.